Welcome. Once again, we are going to bring you a new experience pertaining to just kind of to give you brand new medical knowledge right here from Channel I, and it is time for iMed. And well, today we're here at the Diabetes and Endocrine Clinic right here at the National Hospital of Sri Lanka, and we will be giving you some interesting information. We'll be having a one-on-one session with a professional doctor. We'll be getting an inside look of the diagnostic procedures, and we'll be giving you a ton of information, what you need to know about diabetes. So let's go check this out. And in this edition of iMed, we will be discussing about diabetes, which is an emerging concern within the localities of Sri Lanka. And we do have with us consultant endocrinologist right here from National Hospital of Sri Lanka, Dr. Manilka Samunithalaka. While as I welcome you to the show, I would like to bring the question on behalf of the public. What exactly is diabetes and what's the nature of this condition?
Diabetes is a condition where a person's blood glucose levels are in a state of elevation or persistently elevated over a prolonged period of time. And this is caused by your insulin hormone in the body which is not acting properly. So if you say either the levels are low or the action of insulin is impaired. So due to that, the glucose in your blood does not enter your cells, the fatty tissue, muscle or the liver, and they stay in the blood. So it's very simply, if I want to say, it's a persistent elevation of your blood glucose is called as diabetes.
And depending on circumstances, there are types of diabetes as far as we know.
Yes, that's a very good question, because people think when you say diabetes is just one entity. But I must say the vast majority of our patients have what we call as the type 2 diabetes. But as you can see, there is type 1 diabetes. Then there is diabetes which comes during the pregnancy, what you call as gestational diabetes. Then there are other rare types of diabetes. If I explain a bit more, the type 1 diabetes is seen mainly in children or younger people, where due to a viral infection or any other reason, the insulin producing cells in your pancreas, what you call as the beta cells in your pancreas, is destroyed, and there is no production of insulin, and the sugar levels go up. Sugar means glucose levels, and they need insulin from day one. That's type 1 diabetes. Type 2 diabetes is mainly due to increasing in your body weight, and the insulin hormone is there. It's produced in abundance in the body, but it does not work properly because of the increased weight and what you call as the insulin resistance. So it's a mixture of insulin, the amount of insulin coming down, and insulin resistance. So that's the vast majority is having type 2. It's about 85 to 90%. Then some people during the pregnancy, as you know, it's a stressful period and you tend to gain weight, and those who have the tendency, they get diabetes during pregnancy. And the placenta also makes certain hormones which increases your blood glucose levels. So due to this, we call this condition as gestational diabetes. These are the three main types. Then there are other hormones in the body like cortisol, growth hormone. So, and if there is an excess of those hormones in the body, that also can increase the level of glucose in the blood through complex mechanisms, but that also can cause diabetes. Another common reason when we see diabetes is certain drugs. I mean, they are needed, essential medications which are given to patients for other conditions like steroids or prednisolone, commonly used medication. Essential drug, you should not, if you are prescribed, you have to take it. But some people without supervision, they continue to take or abuse the use of these drugs, and then in that scenario you can get diabetes due to certain medications as well.
And when we try to further understand what diabetes is, pre-diabetes is also a phrase that is kind of discussed among patients. And what is the outlook of pre-diabetes and what is it compared to actual diabetes?
So as the term itself explains. It's the what we call as the precursor for diabetes. So why do we have coined this term pre-diabetes? So before I talk about pre-diabetes, I think I need to tell about the cutoff level, how we diagnose diabetes. So it's a simple blood test, 8 to 10 hours of fasting, and you come and do what you call as a fasting blood sugar. And if your sugar levels or the glucose levels in the blood is more than 126 milligrams per deciliter, we can diagnose diabetes if the patient is also, of course, having some symptoms as well. One reading is enough. Pre-diabetes is anybody who is having a blood sugar of 100 to 125. Or we do another test, what we call as a 75 gram oral glucose tolerance test. We give glucose a challenge and see whether the sugar levels will go up. So in that scenario, if your sugar levels are between 140 to 199 milligrams per deciliter, we call them as impaired glucose tolerance or pre-diabetes. So why do we recognize them? That's the important thing. They have a very high risk of getting diabetes in the future unless you change your lifestyle, change your dietary habits, reduce your carbohydrate intake, sweets, and you have to regularly exercise. This can be prevented, so that's why we have identified this group so that we can take preventive measures. And of course, even at a level of 115 or 120 borderline diabetes, you get the complications of diabetes even if you remain pre-diabetic for a long time. That's the importance of pre-diabetes.
And also, doctor, prior to the point of detection, what kind of suggestive signs or symptoms are vested in a person who might have a high tendency to get diabetes?
Okay, so you are asking about the high risk population. I must say now, looking at the prevalence in our country, which is like going above 20% in the urban areas, and the very latest studies are showing in the Colombo area it's almost going above 25%, 25 to 27%, but we don't have the whole island data. Being a South Asian itself is becoming a risk factor for diabetes, but apart from that, if there is a strong family history of diabetes, the people will be at risk. Then the increased BMI or the body weight, I suppose people know the body mass index. If that is high, then people are at an increased risk of getting type 2 diabetes. Then certain, if you vocations or if you don't exercise enough, then people are at an increased risk. Stress level, sometimes we have no way of quantifying that, but certainly that has a role in that. And of course, certain medications and certain other diseases which can increase the risk of diabetes is there.
And if there's a person who feel like they need to get checked, what kind of diagnostic procedures are available here?
At the National Hospital here, we do most of the tests that's required, but as I told you earlier, it's a very cheap, simple test that we do to diagnose the fasting blood sugar. But there are other tests like the HbA1c. It's the 3 months average blood sugar test. If that is more than 6.5%, we can diagnose diabetes in a proper lab. It has to be done in a proper lab, to standard lab. And basically that's this thing. But of course, the symptoms, I think the public should know the common symptoms of diabetes before you go for a test, or somebody should think about checking themselves. Generally in Sri Lanka, what's recommended is if you are above 35 years, better to get your blood sugars done at least once, and then if that is normal, at least once in 3 years. If you are in the pre-diabetic range, every 6 months or at least once a year, you have to get yourself checked. And in terms of the other test, it's mainly for detecting the complications and other associated diseases like the high cholesterol that we do in this hospital. So basically, most of the tests are available free of cost in our hospital.
Yes. And on the long run, it's important to manage this condition. And we will be, from this edition, of course, we will be showing you an inside look as to certain follow-up procedures. But overall, what kind of lifestyle habits would contribute to managing diabetes adequately?
Yes, our patients, they are taught the first step in managing diabetes is managing your diet. We give them counseling on diet, then we get the dietitian and the nutritionist input from the hospital, and they get a leaflet and booklets, all that to correct their dietary habits. So in a nutshell, it's less carbohydrates and sweets and plenty of vegetables, especially green leafy vegetables and vegetables with fiber, and moderate amount of fat and protein. So that's the a very summarized way of telling about a diabetic diet. Then second step is decent amount of exercise. The prescription of exercise for diabetes is half an hour a day, 5 times a week. 150 minutes a week would be the ideal exercise regime for a person to control the diabetes. Third step would be the various medications that we give, the tablets we have, and there are 11 types of groups of medication available to treat diabetes. So that's the third step. Fourth step would be insulin. If you can't control the diabetes with all these steps, then you have to go for the fourth step, where we give insulin in the injection form. So that's what we do in this clinic.
And before we wrap up the interview segment, I would like to know, diabetes has become a crucial problem not only because it's an independently occurring problem, it has a domino effect on other diseases and other issues in the body. Yes. And when it comes to heart diseases, depression, there's a big relationship that is of interest of research. So could you tell us what relationship diabetes has on illnesses like heart disease and so forth?
Well, if I may put it, I don't know whether somebody has coined this word. It can be called the mother of all other diseases or the problem in modern life, especially in younger people. We see so many problems in our diabetics if they don't control it. So essentially what you are asking is the complications of diabetes and its associations. So it's high sugar itself, once you bring it down to a certain level, patients will be comfortable, nothing will happen. But if you don't control it to target, what we say, a fasting blood sugar of less than 100, HbA1c of 6.5, certain changes occur in your blood vessels due to the high blood glucose levels. These blood vessels will supply your heart, your brain, legs, eyes, all the organs, and the nerves, all that. So when they are affected, the symptoms of or the diseases associated with those areas will manifest itself as different areas. Say let's take the heart for instance. The commonest cause of death in our diabetic patients, 65% of them die due to cardiovascular reason. That means heart attacks and other problems, strokes, blood vessels getting blocked in the heart or the brain. Then there are other problems. The nerves can die due to high sugar levels affecting their blood supply, and you get a severe pain in your legs. Sometimes you can't walk barefoot, you get a tingling sensation, they find it difficult to sleep at night and they lose their sensation. Then if you walk barefoot, they injure their feet, and some of these things we can see later, the complications associated with the foot, and ultimately due to complications, ulcers getting complicated by infections, and they end up with amputations. I forgot about the kidneys. Kidneys getting affected and people going in for kidney failure, what you call as chronic renal disease, is, other than the North Central province, diabetes is one of the leading causes of chronic kidney disease in this part of the country. Blindness. Diabetes is the commonest cause of blindness in the younger population, less than 65-year population. Diabetes is the commonest cause of blindness. So when you see, it increases heart attacks, it increases strokes 2 to 3 times compared to a normal person in the population, can lead to amputations, can lead to kidney failure and blindness. So these are the main problems. Other than that, increased infections, fungal infections, urinary tract infections, so many other minor complications also can occur due to diabetes. It basically affects the whole body. If your sugar levels are high, these complications can come. So my coining of this mother of all problems or diseases is sounds quite reasonable.
Yes, and as I thank you for helping me conduct this interview segment, I think it's time for us to visit the diabetic clinic and see the follow-up procedures. So we discussed a lot of things, and now we're here at the heart of the diabetic clinic at National Hospital of Sri Lanka. And as far as the diabetic patients are concerned, a follow-up is very essential. And from doctor, I would like to know, as far as that's concerned, would you mind telling us what's behind that door?
Yes. What's behind that door is a very important area in the management of diabetes. All our patients who come to the clinic, they are annually screened for complications of diabetes. The eyes, the feet, and their blood vessels. So all that is done to detect problems before it happens. So this is where we are doing all this annual screening inside this room. Let's go inside and see what's happening there.
And finally, we're inside, and with respective consent, we will be seeing a foot examination, which is a very essential part when it comes to following up a diabetic patient. So could you explain to us what's exactly going to happen?
Let's talk to this lady who has come here to our clinic. අද මොකටද මේ එන්න කිව්වේ අපි පාද පරීක්ෂාවට නේද? කකුල් වල මුකුත් ප්‍රශ්න එහෙම දැනට දැනෙන්න අමාරු තියෙනවද? මොනවාද තියෙන අමාරු? තියෙනවා. කොච්චර කාලෙද දියවැඩියාව? Yes, so this lady has come to our clinic, 10 years of diabetes. Now she says she has a callosity, you know what we call a thickening of the skin, which could be a problem later in life or can cause an ulcer even if you neglect. So because of that, she has come to get her feet checked, and our doctor in the clinic will now demonstrate how we usually examine a diabetic foot. Can you please see? So first what we do is as she does, the inspection. So a diabetic feet, there are few things that we have to observe. In between the toes, we are looking for fungal infections. Then we look at the nails, as you can see even in her case, that the certain nails there is funguses in that, and they need proper care. Even problems there can lead to bigger issues like infecting the whole leg. Then she look at all the pressure points, and you can see, if you can check from the other side, this area, now see, because of the diabetes, the nerves have been affected and the muscle tone changes. So the pressure delivery of her foot has changed. If you can see, the shape of the right foot has changed. Due to that, a certain area carries more weight, and that area has thickened and then cause what you call as a callosity. So we need to attend to that, refer her to a surgeon and get that attended. Otherwise, there can be a ulcer, a wound forming here, which can be as deep as few inches sometimes, and that can cause a problem for her feet. So now she is going to check the nerve function, what we call as the sensation of her feet, using this thing called the monofilament. So that is what we do to see whether she can feel. So මේක දැනෙනවා නම් ඔව් කියන්න. දැනෙනවද? Now we are sort of not pricking, actually touching her with this monofilament, but certain areas she is not feeling it. Other areas she says she can feel. So the nerves are partly affected in her case. So that is what we do here in this area, checking the feet. This we do in all the patients, and then we have another gadget called the biothesometer, where we check the vibration sense of the feet. That is also another modality of sensation like the pain, we check whether she can feel the vibration.
Well, the path to recovery is quite a journey for some, and for some, this clinic has become a home. So, we would like to know about this very special patient who has been visiting, I suppose. Could you tell about her story?
Yes. ඔයාගේ නම කියන්නකෝ අම්මේ.
අනුරාගුන් චේවා.
දැන් කොච්චර කල් ඉඳලා ක්ලිනික් එකට එනවද?
දැන් මට 2000 ඉඳන්
2000 ඉඳලම දියවැඩියාව තියෙනවානේ. මේ පහුගිය කාලේ හැම අවුරුද්දෙම මේ මෙහෙම පාද පරීක්ෂාව ඇස් පරීක්ෂාව කරගත්තද?
හැම අවුරුද්දම පරීක්ෂණයක් කියලා
කරනවා. දැනට මොනවද තියෙන ප්‍රශ්න වලට දියවැඩියාව සම්බන්ධයෙන්? Hari, I think this is we can be very happy. She has been attending this clinic since almost for more than 15 years now. She has been following our instructions almost to the letter. She is very careful with her diet. She exercises regularly on a daily basis, walking for about 2 to 3 kilometers, and she has got her feet, eyes, and other tests done yearly without fail. So I think she is a very good example of how diabetes can be managed without causing any problems. And people with diabetes, the message that we want to give is that they can lead normal, comfortable lives without any problems if you do little things as instructed.
So now we discussed a lot of important things, and we do have another candidate to show you another specific way as to how you can do your follow-ups, and that is pertaining to the eye examination.
Yes, that's right. This gentleman here has come for his annual eye screening. Let's see what he has to say. නම කියන්නකෝ ඔයාගේ?
AD Samson.
He's Samson. කොච්චර අවුරුදු කීයක් දියවැඩියාව තිබුණාද?
2009 ඉඳලා.
So he has been having diabetes for the past 10 years now. කියන්නකෝ ඇස්වල ප්‍රශ්නේ මොකද උනේ කියලා?
මගේ ඇස් පරීක්ෂා කරා.
ගිය අවුරුද්දේද?
නෑ නෑ. අවුරුදු දෙකකට
දෙකකට. ඔව්.
පරීක්ෂා කරලා බලලා කිව්වා මගේ ඇස්වල සුදු එනවා
කියලා. හරි.
මට මාව ලියුමක්
දීලා assessment. Okay.
ජාතික
So what has happened is we have detected some changes due to diabetes in his eyes 3 years back, and we have referred him to the eye hospital, and he has got treatment done there for his cataract and laser treatment. So now he is doing fine. හොඳට පෙනීම තියනවාද එයාගේ? So his vision is very well, very good, and he has just come for his annual review to get his eyes checked, because it's an ongoing thing. You can have one problem and you can attend to it, but next year something else might come up. So though we attend to it, every year you have to get your eyes checked. So that's the message we want to give all the diabetic patients, that please get your eyes checked at least once a year. So this equipment we use to screen the eyes. We put some eye drops to dilate the pupil, and the doctors in our clinic are specially trained at the eye hospital, and they do the initial screening part where they look at the inside of your eye, what you call as the retina, and if there are any changes due to diabetes, we send them to the eye hospital for immediate remedial measures. So good control of blood sugar is essential, control of high blood pressure, control of the cholesterol levels, and if there are problems, the eye surgeons will decide whether they will need laser therapy, or there are newer types of drugs which are given as injections. So all these things are given free of charge to our patients in the government sector.
Now we checked out a lot of things, and now we're going to move on to another excellent candidate. And well, when it comes to management of diabetes, vascular health plays a very important role, and regular follow-ups are very important. And if we can elaborate as to what's going to happen next.
Yes. So now we check the nerves, we check the eyes. Now it's the blood supply to the limbs that we are checking. Because as you know, diabetics, there is narrowing of the blood vessels. It can be in your heart, brain, but the lower limbs is an important area where there can be narrowing. And if there is narrowing, there is no blood supply to the distal part of your limbs, and that can cause problems, what we call as gangrene, and then which can end up in losing your limbs as well. So we regularly screen to check whether their blood supply is all right. So you can see in this lady, I will first have a chat with her. Wage nama kiyanna? She's Priyanti. Kochchara awurudu gana? She has had 17 years of diabetes. So she has had issues regarding the control of diabetes before, and she says now after coming to this clinic, she was advised on lifestyle modification, and then she's having a very good control and she has no complaints at the moment. But let's see how her limbs and the blood supply to the limbs are by doing this, what you call as the vascular Doppler study. So what we do here now is we are checking the blood flow in the arm with a what we call as a handheld Doppler. That small gadget the doctor is holding is called the Doppler, and the noise you get is the blood flow. So we check the level of pressure where the blood flow can be blocked, and then she will check the same thing, the pressure and the blood flow in the lower limb, and there is a certain calculation, and if it is below a certain amount, we can assume that her blood flow to the limb is impaired. There is narrowing of the blood vessels in the limb. In that scenario, we have to refer this patient to the vascular surgeons who do a good job in sometimes revascularization or the bypass, which is we talk about bypasses in the heart, but the same thing can be done in the limbs as well. This is the area where we have the retinal camera. What you mean by the retinal camera is a thing we look at the inside of the eye, what we call as the retina. We can get a photograph to see whether there are any changes due to diabetes. Then with that record, we refer the patients to the eye hospital if there are any changes due to diabetes. So what you see now is actually the photograph of the inside of his eye, and if there are any blood vessels or bleeding inside, there will be red dots, and if there are any exudates, what we call as, there will be yellow dots. So all these things can be detected very easily and attended to if we screen them regularly. This is another patient who has come for the annual screening. Let's see what she has to say. Wage nama kiyanna? She is Jayanti. අවුරුදු කීයක් විතර දිය වැඩියාවද දැන්? She has had diabetes for 3 years. මේ අවුරුදු 3 ඇතුළත මුකුත් ප්‍රශ්න එහෙම තිබිලා තියෙනවද අමාරුකම්? So she had a weight loss and she complains of pain and numbness in her hands and feet. So she's here now to see whether her nerves are affected. So she, as you have seen before, she'll be going through all the eye and nerve testing here and the vascular testing as well.
From iMed, it is our prime goal to enlighten you with anything you need to lead a life with happiness and well-being. And with that blessing coming all the way from everyone from ChannelEye to you, it's time for us to wrap up and go. But until next time, hope you have a wonderful week. See you.